Welcome to the GoalZero Toolbox Talk series. Today's Toolbox Talk. Chemical route. Hazardous chemicals can penetrate the human body through various orifices. There are 4 possible routes a chemical or substance could enter the human body: inhalation, ingestion, absorption, or injection. Employees must understand what these routes are and how to protect themselves. Inhalation is the most common way hazardous chemicals enter the body. Toxic chemicals in the air go through the nose and mouth and are absorbed into the body system. The inhaled gases spread rapidly through the circulatory system and cause severe damage to the body tissues. The absorption rate and degree of resulting injury depend on how concentrated the chemicals are, their solubility in the body fluids, and the duration of exposure. Ingestion is another common route through which toxic chemicals get into the body in workplaces. Laboratory chemicals can cause severe health problems if they get into the mouth or are swallowed. And once they get into circulation, they can cause serious damage to the body tissues. Employees are advised never to taste chemicals or pipette liquids with their mouths. The absorption of chemicals can occur when toxic substances get on your skin or your eyes. Usually, skin contact with chemicals is a common cause of chemical injuries. It can result in mild irritation or a severe form of poisoning. When your skin meets toxic chemicals, many substances are quickly absorbed into the bloodstream and can lead to systemic poisoning. The major points of entry for chemicals through the skin are the hair, sebaceous, and sweat glands, as well as cuts or abrasions to the outer skin layers. Blood vessels are plentifully present in the follicles and glands, further aiding in the absorption of chemicals into the body. Another way chemicals are absorbed is through contact with the eyes. Eye contact with chemicals can cause serious eye irritations. Workplace chemicals like strong acids, phenols, alkaline substances, and phenols are all particularly corrosive and can lead to permanent vision loss. Others might cause pain, irritation, or temporary loss of vision. Contact with hazardous chemicals through injections is quite rare in workplaces. However, this can happen unintentionally in the chemical lab due to mechanical harm from chemically contaminated sharp objects like glass or metal, or when chemicals are handled in syringes. Now that you know how chemicals can enter your body, you can take steps to protect yourself. When working with hazardous chemicals, always wear proper protective clothing, which includes gloves, masks, and goggles. Chemical safety is important for employees because it helps to protect them from the dangers of working with hazardous chemicals. When employees know the most common routes of entry for these chemicals, they can take steps to protect themselves and avoid dangerous situations. In addition, safety talks about chemical safety can help ensure that employees are properly trained to handle and use these chemicals safely. Chemical safety is achieved by undertaking all activities involving chemicals in such a way as to ensure the safety of human health and the environment. It covers all chemicals, natural and manufactured, and the full range of exposure situations from the natural presence of chemicals in the environment to their extraction or synthesis, industrial production, transport, use, and disposal. All these routes of entry can be dangerous, but inhalation is the most dangerous because the chemical can get into our bloodstream quickly and cause health problems. When working with hazardous chemicals, it is important to wear proper protective equipment, such as gloves, a mask, and goggles. It is important to be aware of the dangers of hazardous chemicals and take precautions to protect ourselves.